So, next panel going to be led expertly by Ryan Morhart. Ryan has gotten a couple shout outs already. He is really leading the effort on global health security for the World Economic Forum. For those of you who don't know the World Economic Forum, it's really a forum that brings together the leading business leaders around the world. Its most famous manifestation is its event in Switzerland, Davos, every year in January. But it actually does a tremendous amount of stuff throughout the year. And I would say the last couple of years, we've seen incredible leadership from WEF on this issue of global health security. Ryan, thank you for that, and thanks for leading us on.
Well, thank you for the introduction, Sheesh. And thank you, I should say, we noticed we're one of the last panels, so just to take a moment to thank all the organizers for Outbreak Week. It's really an incredible undertaking, really well done, and really appreciate the chance to be a part of it. And really a privilege to follow Ron, so thank you, Ron. But it's especially a privilege and an honor to introduce this panel, and we appreciate that public-private cooperation can be on the agenda, and we're looking forward to hearing from the panel. But when it comes to public-private cooperation, maybe we could set the stage by just sharing three things. First thing on public-private cooperation with outbreaks is the private sector has every reason to engage in outbreak and epidemics and mitigating the risk and impact. I think we've discussed for a few reasons why, but I'll tell you just a couple. One, is these outbreaks and epidemics are incredibly costly. We heard a little bit earlier from Larry Summers on this, but it's that the annual cost of outbreaks seems to be maybe 0.7% of global income, which is on the level potentially of climate change and the risk of climate change. In fact, it is actually striking that, broadly speaking, and really maybe at risk of speaking too broadly, while we continue to get better at managing the risk and the health risk of outbreaks, and of course important work remains in that regard, but while we continue to get better at managing the health risk of outbreaks, we're seemingly getting worse at managing the economic consequences of outbreaks. For example, we saw in SARS in 2003, with only 8,000 infections around the globe and 800 deaths, we saw a global cost to the economy of $50 billion. And more recently, MERS in South Korea, with 38 cases, we saw a 41% reduction in travel and really dramatic changes in consumer behavior across the entire region. So I think it is safe to say that we're past the point where businesses, especially large businesses, can afford to neglect the risk of outbreaks and epidemics. The second thing to keep in mind when it comes to public-private cooperation is there are several areas where public-private cooperation is essential to effective global readiness. It's non-optional. And we've discussed today, throughout the day, and really throughout even from yesterday, on vaccines. And so, of course, medical countermeasures development and deployment is one obvious area of essential public-private cooperation, which has justifiably received a lot of attention from this esteemed group over the last couple of days, and really it's been on the agenda. But there's other areas as well where public-private cooperation is essential and non-optional. That's in areas of pandemic supply chain, which we'll discuss more today. Also in areas of data and data innovations, which we heard a little bit from the prior panel on. And in areas of communications, which we'll hear some in just a moment. In finance, again, which we'll hear in just a moment. And also in travel and mobility, which Ron has just mentioned a moment ago. I'll just say a note because we don't have a panelist on travel and mobility, travel and tourism. What we've seen with the last couple of responses is that the easiest thing to do has been to close your border or cancel your flight. Not that it's easy, but that's sometimes the most politically expedient thing to do. There are several ways that we can make that a little bit harder to do, and you only do it when it's in the right in the right time, in the right place. And that's something I think would be worthy of the attention of our community. To think about how can we make that a little bit harder to do, knowing that that race to the bottom threatens the response and communities and really the outbreak alike. Finally, on the third item of public-private cooperation before we introduce the panel, we've already said that businesses need to be engaged out of their own interest, out of the economic interest, that public-private cooperation is required. And finally, maybe obviously, that in these areas, these 5 or 6 key areas of essential public-private cooperation, some really obvious and simple challenges remain. And even though they're simple challenges, good operationally integrated public-private cooperation is really hard. And so this is where I'm really happy to hand to the panel to talk about what are the things that we can be doing in these spaces where we can find that magic solution for that operationally integrated public-private cooperation. So with my pleasure, introducing a couple of the panelists. What I'll do is I'll introduce each of you, and then Mike, maybe I'll put you on the spot and have you come up first. But first, let me introduce the entire panel, and then we'll hear from each panelist, and then we'll have a dialogue together. So first, welcoming Maggie Farley, the Executive Vice President of Global Crisis and Risk at Edelman. So thank you for being here, Maggie. Gerard Muchner, Chief of Global Communications Officer at Henry Schein. Thank you, Gerard. And Tobias Millet, Vice President, Global Partnerships at Swiss Re. Thank you for being here, Tobias. And finally, to come up to now for some remarks, Dr. Mike Ryan, the Assistant Director General for Emergencies at World Health Organization. We've all heard from Mike a couple times, and of course we hear Mike's name mentioned. But if you weren't here yesterday, you didn't hear Mike referred to as Indiana Jones. So he's not asking us to call him that, but it's starting to take.
Good afternoon. Thanks, Ryan. And this is a Groundhog Day for me. I think I was here yesterday. So yesterday I spoke to the topic of vaccines for outbreaks in the modern world, and we had 2 excellent panel discussions moderated after that. One panel spoke on the end-to-end issues facing us in vaccine development and delivery and equity. Second, probably more important panel talked about the challenges creating community demand, acceptance and trust around vaccines. And it was a very interesting discussion to be part of. Today, I think, again, we remember the pain, the loss and the suffering of the 1918 pandemic. We again salute the heroes who worked and saved lives. And I hope we, collectively as a community, can commit to doing everything possible to keep the world safe from another high-impact epidemic or pandemic. In the last 100 years, we've made much progress in this endeavour in terms of understanding disease emergence. You saw that today, developing better prevention, detection, and response measures. And we have recognised, as Ryan alluded to, the broader societal, economic, and political impacts of these diseases. So, as I said yesterday, all is well. Well, all is not well, because are we ready for the next big one? And for me, the resounding answer is no. Sometimes when you've got a problem in life, you look in the mirror and you ask yourself some questions. I tend to do that a lot because I make a lot of mistakes in my life. But and so let's see if we look in the mirror and can we answer the questions. Do we have accurate forecasting and prediction of likely pathogens, their origin, spread, and impact? Do we have sensitive intelligence and surveillance systems everywhere in the world to rapidly detect and confirm possible events? Do we have all the capacity at all levels in all countries to rapidly respond to outbreaks and prevent larger scale spread? Do we have the best countermeasures possible in terms of drugs and vaccines? And do we really understand how to implement non-medical countermeasures in confused and panicked communities? Do we have the trust and confidence of our own communities? And are they fully engaged and empowered in the fight against epidemics? The answer to all of these questions, I think, is, as with all human answers, it's kind of a yes and a no. But in my view, it's mainly a no in relation to a lot of them. And one last question. And this is where we come on maybe to the public-private sector. To use the American vernacular as I used yesterday, have we emptied the bench? In other words, if we accept that epidemics and pandemics are the greatest threat we face as a civilization, have we mobilized all the ingenuity, the skill, the passion and commitment of all parts of our global village to protect, preserve and restore health, economy and society? Can we answer that question when we look in the mirror? I would argue that we have not, and there are two sectors that we need to mobilize urgently in this regard. Our own communities, everywhere. We have not been successful at building trust, engagement, acceptance and participation of communities. This argument is an argument of the experts and has been for a very, very long time. But we also haven't mobilized our vibrant private sector everywhere. Some places, yes. Most places, no. The private sector has a stake and a responsibility to help answer all the questions I've asked in the last couple of minutes. We're co-accountable because we serve our communities. Yes, it's clear we have pharmaceutical companies that have a major role to play in pandemic preparedness in terms of the development of drugs and vaccines. But as Mike Osterholm said yesterday, we've yet to come up with a downstream business models that work for the development of epidemic countermeasures. It's a major challenge that needs to be addressed urgently, and one that WHO is working with partners on. We do have one superb global public-private partnership, which is the Global Influenza Surveillance System. We produce global vaccines every year for 2 hemispheres based on the free exchange of risk data, virus data, and others with industry to come up with an effective vaccine, although we were arguing the effectiveness of that vaccine this morning. But that vaccine happens because of a 50-year public-private partnership. Our research and development blueprint lays out roadmaps for the products we need. CEPI and others are providing upstream financing. But again, as we said yesterday, the governments need to take leadership in creating the environmental conditions and incentives where such innovation and delivery can occur. Beyond the obvious drugs and vaccines we think about, because very often in our game when we think about public-private partnership, we think drugs and vaccines. There are so many other areas where public-private partnership can be hugely helpful. We already have our Global Outbreak Alert and Response Network. We have hundreds of institutions working together to deploy people and teams to the front line before, during and after epidemics. Sorry, I lost my page. On the private sector side, and this is I reflect on what Ryan said, and I know he won't blow his own trumpet, but we've been working very closely with WEF, a number of great foundations, UN organizations, and many players from the private sector, including Henry Schein, on an epidemic readiness accelerator, looking at challenges as diverse as, you said, supply chain management, data and IT innovations for forecasting, predictive and visual analytics, simulators, epidemic intelligence, innovative field data capture, communications technologies for risk communication and community empowerment, policies and solutions for rapidly managing regulatory and liability issues, and working with the travel and tourism industry to deliver better risk information. Beyond that, and critically, and this is maybe the main point I'd like to make today, we have a massive challenge of building core preparedness capacities around the world. The capacity to detect and respond to epidemics is not evenly distributed. We are only as strong as our weakest link. A broad coalition is developing around this challenge, and we're working closely with the World Bank, with the GHSA, Resolve, many other foundations, and the private sector to try and make the vital progress we need to make. So all in all, we have a massive challenge. Even if we are to respond to the outbreaks we face every day. And in some senses, these are I think someone said it before in the previous thing, there is no peacetime anymore. There's no peacetime to build the weapons to defend ourselves in wartime. We're at war. We have cholera, we have monkeypox, we have Lassa fever, we have outbreaks. At one point, 12 weeks ago, I think we had 8 of the diseases on the priority pathogens list actively causing outbreaks in one part of the world or the other. The only thing we didn't have, I think, was disease X, and I was waiting for that one. So, if there is no peacetime, we're challenged every day. We must use these challenges. We must leverage these to develop the products, the systems, the networks and capacities that will serve us well in the future when the big one comes. I've said yesterday that I've been accused of being a pathological optimist. Well, my staff think I am anyway. I wear this badge with pride. But I also contend I'm a pragmatic realist. I just believe that we can achieve so much if we just recognize the scale of the challenge and work together relentlessly to find the solutions. I quoted JFK yesterday, and today I'll vote by, I think my grandfather would have been very pleased, great Irish American. I'm now going to quote Winston Churchill. He's turning in his grave as we speak. But he said, "A pessimist is one who sees the difficulty in every opportunity. An optimist is one who sees the opportunity in every difficulty." Thank you.
Thank you, Mike. Please, Maggie.
So I'm actually going to take a step back and look at one of the work areas that Mike just mentioned. So I'll drill down to one of the solutions that's currently underway through the World Economic Forum. And I'll be speaking to you really with two hats today. One is the co-chair of the Communications Working Group that you just saw up on Mike's slide. And the other as a communication specialist and someone who leads a health crisis and issues crisis team back at Edelman. And in that team role, I work with a lot of major multinational corporations. So hopefully I'll be bringing some insights from that work to the discussion today. So in terms of the Communications Working Group, we've talked in the last probably hour a lot about how do we bring big businesses into the solution. And one of the things that we're working on this working group is to find ways to really engage big businesses, big, large employers, in a capacity building way where they can serve actually as a communications channel. We recognize that large employers have a lot of influence, they have a lot of reach, and they certainly have the means to quickly and rapidly reach out to all of their employees. So we want to work with them, and I'll walk you through some of the strategies that we're developing to make sure that they can readily and reliably augment public messaging and help manage the rumors and misinformation that is always surrounding a real or perceived epidemic. And we want to make sure that we're using them well to amplify credible information. And I think that's where the start of some of the private-public partnership can come in. And really, how do we use big businesses with great reach to work with the public health officials to make sure that we're actually preempting or minimizing or correcting all the misinformation that creates the fear. So I think a lot of what I'm going to speak to right now we've already covered in the morning sessions, but I want to talk about the challenges of bringing big businesses on and why it's so important we use them as a communicator, and then also the opportunity, both from a public health perspective and from the perspective of a company. So the challenge, I think everyone agrees, we just heard from Ron about the media and the media hype, not knowing what's true or what's false. But the information vacuum itself is what can create fear. And so we do recognize that when there is an epidemic or a rumor of epidemic, we need to find ways to close that gap and get information out quickly, but it has to be reliable. And I think everyone will agree that delivering information when it's fragmented is one of the greatest challenges. And sometimes one of the things that we struggle with is, while the public health officials are trying to get the accurate information, as we heard earlier, the media is looking for the headline and the story. So we're trying to find ways in which we can actually close that gap. And when you look at the ways big businesses communicate with their employees, they do have channels to push out information really quickly. So finding the accurate source to get the information out. And this is probably one of the more important points, and I certainly don't want to go over all of the issues already shared, but during an emergency, the current lack of trust can easily create greater fear, greater misinformation, and actually lead to dangerous actions. So when we think about trust, one of the insights or stats that I'll share with you today is we do at Edelman what we call the trust barometer. For 18 years, we've been looking at trust across all the institutions worldwide. This year, we surveyed more than 30,000 people in 28 countries. And I think when we look at the communications working group and trying to involve businesses as communicators, it's really important to point out that in this year's trust barometer, we found that 64% would trust a CEO over the government. And that's a big shift. So right now, I think the stat is 22 out of 28 countries now say that they trust business more than they trust their government. So we need to find ways to leverage that and to use it in a way that is actually helpful and progresses or advances information sharing during epidemics. In terms of the opportunity, I've talked about the need to engage businesses as communicators. They have the ability to cascade out information very quickly. And as I've just mentioned, they're trusted. So let's find a way to leverage them. More importantly, we can talk about the business reasons, the financial reasons and incentives for companies to become involved. But I also want to point out an important point where when we talk about employees trusting CEOs, those same employees are also saying in the trust barometer that they want their corporations, they want their CEOs, they want their companies to stand up and actually speak to and represent some of the bigger problems that we're facing as society. So corporate leaders can actually use this as an opportunity to show leadership. And I think in doing so, if they were to get engaged and to think about how they could react and be responsive during an epidemic, not only can they show leadership, but they can certainly do a major job in making this more about a mindset, a shift in mindset, as well as practice. And by doing so, publics then can be appropriately informed. I shouldn't say singularly appropriately informed, but we could augment what's already being shared by the public health authorities to make sure they're more fully informed. So some of the activities underway, and the working group now has been working together for less than a year, but we've identified these 4 specific strategies. And I'll give you just a little bit of information on each. First, learn from instructive examples of how public-private cooperation has supported pandemics before. But as a crisis communicator, I'm also looking at companies that have actually managed crises in general well. What are the best practices in terms of communications, that rapid communication that's necessary when you're in an emergency situation? So we're looking at those types of analogs to determine best practices that could be applied and actually turned into strategies and toolkits, a very, very specific corporate-focused toolkit that can support this integrated partnership concept. So if we think about best practices, just a couple of things that I want to share. And I know this is very tactical, but when we're looking at solutions, it's time now to start thinking also about what it is and how it will work and some of the tactical aspects. Preparedness plans, when we think at the highest level, they really need to be supported by the executive leadership. To work, any kind of preparedness effort at the corporate level has to have the support and sponsorship of the C-suite. There needs to be that deep commitment to develop, refine fluid and flexible plans. And those plans could be based on an economic incentive, or as I mentioned earlier, the incentive to really protect and safeguard an employee base, not only for economic reasons, but for the social reasons that companies are aiming to achieve. A really important aspect here is another point for public-private, is any corporation needs to have a multifunctional task force with very clear roles and responsibilities and jurisdiction of authority. But what most companies don't have, if they're forming a task force to deal with any crisis, but in particular an epidemic or a pandemic, is they don't have on staff the right subject matter experts. So any public-private partnership, a task force that's formed, has to have that liaison or that network and the ability to pull in from the public health sector accurate information. You know, we need epidemiologists. We need to know the severity. Should we be worried? Is this at rumor level? Is this really at a level that we need to act? So that multifunctional task force, again, needs to find ways to develop relationships and develop those relationships quickly at the global, regional, and certainly at the local level. We need policies and protocols. These are already underway in many companies, but what do you do about travel? You know, when you think about preparedness, how can we work with those who have lived through epidemics in firsthand to get those lessons learned to decide monitored movement? Should companies have policies on that? Should they be quarantining? How do they handle absenteeism? So many different policies that need to be taken into consideration. Some are legal and some are more along the moral and ethical line. But these are the types of things that companies can be doing in advance. And then finally, and I think this is where the toolkit from the WEF working group can come in, is during the time of an incident or when there is an epidemic, if they have their procedures and policies in place, we could tap together, work together to really make sure companies know how to interpret what's happening in terms of the case investigation, knowing whether or not they need to assign a level of threat. How do they then internally within the company help prevent the spread of any kind of epidemic? And then more importantly, how do they, again, serve as a channel, a communications channel that can augment all the information that they're getting from whether it be CDC or WHO? So again, going back to the goal, to really work closely with the public-private partnership to establish a network of very large employers, doesn't have to be private, but a large network of employers who can actually help push out accurate information in a way that's rapid and also actionable. And in doing that, we really hope to cultivate what we're calling this cross-sectoral community of stakeholders. So again, businesses, their supply chains, their partners, their employees, all who would be committed to maintaining and testing and really refining how we can approach emergency communications during an epidemic. Okay.
Super. Thank you, Maggie.
Thank you. So I'm the finance guy on this panel, and let me start by saying that I don't work in public health. Obviously, is it working?
You might need to get pretty close to it.
Is this okay? Better? Okay. Tell me if you're not hearing me well. So I was saying, because I don't work in public health, but was actually trained in public health, the fact that I somehow, and never worked in that field for a day in my life, the fact that I somehow managed to claw my way back onto a panel on this topic somehow is a personal triumph for me that you don't even appreciate. So I work for a company called Swiss Re, and like every company whose name ends in re, that is a reinsurance company. I'm going to talk about something that I suspect you've heard about, which is the Pandemic Emergency Financing Facility, the PEF, P-E-F. The Pandemic Emergency Financing Facility is a World Bank initiated, implemented, and owned project that is a set of implementation guidelines, government's framework, and different sources of financing to provide surge funding to better respond to outbreaks, and that was initiated by the World Bank Group's president, Dr. Jim Kim, even before the Ebola outbreak in West Africa was fully over with. And so I'm going to talk about the transaction that is the heart of the financing for that facility, which is a market-based insurance transaction, in which I was involved in my capacity working in the insurance industry. Frankly, I have learned to assume that any information about insurance is too much for information for most people, and I'm not here to convince you otherwise, but I think we need to speak just a little bit about how this product works, and then I'm going to focus my remarks on how it contributes to the ambitions of the PEF and what is most innovative about it. And so when the World Bank approached Swiss Re and another handful of companies and said, "Can you design an insurance mechanism that would trigger and pay out early during an outbreak to provide that surge funding to better contain it," which is one of the critical, sort of in hindsight, the lessons learned from the Ebola outbreak in West Africa, that funding was late to arrive. It became apparent that there is a class of securities that lends itself, at least in principle, to that ambition, and that is called parametric insurance. And parametric insurance, as opposed to our car insurance, where you sign a policy, then you bump into somebody, and then you have to submit information to your insurance company, and you have to sort of prove what happened. They talk you out of it, and then if you're lucky, you get some money. Parametric insurance is a product where you define a an objectively observable parameter called an index, and as soon as that is observed to have reached the pre-agreed threshold, it pays out. So obviously this is not insurance for you and I, this is insurance that some corporates buy for natural risks, and governments are increasingly using also to sort of stabilize their financing following natural disasters. So in other words, you would say if third-party meteorological agency A observes seismic activity B in within the boundaries of administrative area C, then this pays out. Okay, so it's very quick to pay out, and it's fairly transparent. And so the World Bank's under the World Bank's guidance, this work eventually led to such a transaction whereby the World Bank, as the insured, buys $425 million of insurance against a finite list of pathogens, which includes Crimean Congo, hemorrhagic fever, Lassa, filoviruses, coronaviruses. You can tell I'm not the expert on this, including Ebola. That's important to know for the story, because that was really the event that triggered it. And this risk was structured in such a way that investors can gauge, according to a model, the probability of it triggering, because the triggering threshold for each one of these is defined in terms of number of confirmed cases by WHO, confirmed deaths. There's a component of geographic spread. So, for example, for Ebola, it has to have been detected in 2 countries, not only 1, and so forth. And then the model that underpins this product basically tells the investors what is the modeled probability of that qualifying event, that triggering event happening. And when you have that type of probability, you can talk to financial markets, because they say, all right, well, if you're telling me this has a probability of 5% of triggering every year, and I agree with your model, then I'm going to need a little bit of risk margin, but I'm happy to take that risk at 8%. And so this is an in-force coverage. The coverage is a 3-year term coverage. It incepted in July 2017, so we're a good year into it. Obviously, the World Bank pays premium to these risk takers, which are sophisticated large investors who have specialized investment units in this type of instrument and this type of security. And it's basically sitting there and waiting to be triggered. If it doesn't trigger at the end of the 3-year period, then the investors receive their principal back, and they will have received the regular coupon payments over the term of the instrument. And that will be the end of it. Now, that's enough on the product. What I want to focus my remarks on is how this complements the ambition. So the ambition of the Pandemic Emergency Financing Facility from the beginning was to secure funding before an event happens, and to have it be as transparent and as locked in, if you will, as possible. And by placing this risk in the market and paying the premium that the market requires for that, you were working with a level of sort of inflexibility, if you will, that is unprecedented in donor funding. Because now all of a sudden you know that if so and so many cases of Ebola are reported by WHO over this rolling period, and according to all the parameters that are predefined, if that happens, then the World Bank is going to receive this money. And knowing this forces them to think about, well, first of all, what are they going to do with that money? Okay, so there's all this contingency planning that has been conducted, or is actually still ongoing, I think, as part of the Pandemic Emergency Facility. In other words, how are they going to use this money? How is it going to reach? Who are the responding agents who are eligible to receive the funds? What are they going to do with it? How are you going to get it there? Do you have their bank account number? And all of this. Because the product is going to trigger and pay out probably within about 3 weeks. And that really puts the onus then on planning how you're going to use that money. The second thing that this forces you to think through is, well, what if it's not triggered? What if I don't get money, but I still have an outbreak that I want to respond to? And so you need to complement such an instrument with different sources of financing, and that's exactly what they did. So there's a donor, a more traditional, I'm going to call it donor-funded pot of money sitting underneath the insured layer. And that was triggered by, for the first time, by the Ebola outbreak in Western DRC that was officially declared over in August or late July, before the ongoing one, the current one, then broke out in Eastern Congo. And so the pandemic emergency facility, I suspect you've heard the term, is a set of different financing sources, pre-agreed, and also pre-agreed implementation rules in the government's framework. There are people who have different, there's a PEF coordinator, and so everyone kind of, it's all waiting there and sitting. And this is as far as I understand, and certainly the first one that we've been involved in, quite a shift in emergency response and international emergency response, from waiting for something to happen and sort of having agreed on how you're going to react to it, to actually thinking it all through before it has even occurred. And I think I'm going to just leave it there. Perhaps we'll have time to field some questions on the details a little bit later. Thank you.
Thank you.
Can you all hear me? Good, wonderful. Good afternoon. My name is Gerard Muchner. As Ryan said, I'm the Chief Communications Officer of a company called Henry Schein. I have to say, it's quite a humbling experience for me to be here. You could have doubled my high school SAT scores and I still would not have gotten into Harvard. So the idea that I'm speaking behind a podium that says Harvard Law School is really quite something. I am here representing the private sector and speaking specifically about supply chain. Let me tell you briefly about Henry Schein. We are not a consumer products company, so I'm assuming most of you have not heard of us. We're based just outside New York City. We're a Fortune 500 company, have about 22,000 team members, about $12.5 billion in revenue, and we are a very large provider and distributor of infection control products, gowns, gloves, masks, all of the things that doctors need and physicians need to respond to an emergency. And we've had a long history of emergency preparedness, but the discussion for us really changed around the Ebola crisis. One day at my desk, I got a phone call from the CDC. They called me directly, and it was actually the CDC Foundation, and they said, "Can you donate supplies to us, because we have all these physicians who are going to West Africa, but we don't have the equipment to give them." And it's a whole separate political issue I won't go into about why the CDC itself couldn't equip these folks. But the CDC called us, and so, of course, we donated everything they wanted. They sent us a long list of products, and we made the donation. But that again was in 2014, but that began a discussion that culminated at the annual meeting of the World Economic Forum in Davos the following January. And there was a meeting among the CEO of my company, a fellow named Stan Bergman, who happens to be from Africa, which is relevant to the discussion. And what I would call the 4 Ws, the World Economic Forum, the World Health Organization, Mike Ryan's group, the World Food Program, which you may not be aware is the logistics arm of the United Nations, and then the World Bank, and Tobias mentioned the work that the World Bank is doing. And so there was a meeting late on a Friday at the end of the annual meeting, and the Director General of the WHO at the time, Margaret Chan, said, "What can we do working with the private sector?" And so my CEO said, "Anything you want us to do, call us, we will be there." And that led to what is now an organization called the Epidemics Supply Chain Network. And the Epidemics Supply Chain Network is a coalition of organizations, companies you would have heard of. Johnson & Johnson is one. UPS is a company. Becton Dickinson is another large participant. Henry Schein serves as the private sector lead of the Pandemic Supply Chain Network. And our purpose is to improve supply chain response to an outbreak. At a meeting in Geneva at the Forum's offices a few years ago, I had the privilege of sitting with the president of the World Bank, who himself is a physician, Dr. Jim Kim. And we had a long discussion about the challenges of getting basic supplies into the field. And he said, so now I realize pandemic response is fundamentally a supply chain exercise. And it is a supply chain exercise. Ron Klain spoke earlier of the wonderful work that NGOs do in sending physicians into the field. And these are heroic people. But we shouldn't make them suicidal. They shouldn't go into places without the proper equipment they need to protect themselves, and the gloves and the gowns and the masks, right? Because if they don't have that basic equipment, they're much less likely to volunteer to go into the field, and we shouldn't put them in that place. So the Ebola crisis taught us one enormous lesson, which is that we have failed to learn the lesson from all of the other outbreaks that have preceded it. A perfect example. During the Ebola crisis, the Wall Street Journal wrote what is, in our community, a rather famous front-page story about how hospitals all around the United States were attempting to gobble up all of the personal protective equipment, as we call it, the gloves, gowns, and masks, because of the Ebola outbreak. Now, the chances that a community hospital in Des Moines was likely to have an Ebola patient was extremely rare. But America being America, every hospital gobbled up what they could, right? When in fact, the best way to protect the spread of the disease was to send that equipment where it was needed, which is West Africa. So it dawned on us that we have this enormous supply chain imbalance where in these moments we're not getting the supplies to the places it needs to be, and rather those countries that are wealthy and have the ability to absorb the supplies and to act in their self-interest. So Ron Klain also threw out the challenge, which we're happy to address, that the private sector needs to do more, and we absolutely need to do more. Every sector of society needs to do more, and specific to supply chain, I can tell you that Henry Schein and the companies that are involved in this network absolutely want to do more, which leads to another interesting development. And I'll speak frankly here, and Mike Ryan have had this discussion. Historically, there has been a level of perhaps misunderstanding and distrust between the World Health Organization and the private sector, and it's pointless to belabor why that is. But the good news is we have been using this period of time since the Ebola crisis to get to know each other really, really well. And this is enormously useful because you don't want to start exchanging business cards in a crisis. You need to know who all the players are. And in a meeting in Geneva at the World Health Organization a few years back, I sat right beside Margaret Chan, who said to me, "We want to work with the private sector. We need to work with the private sector. You guys have the products. You ship the products. Without you, we can't address the outbreak." By the same token, we in the private sector absolutely understand the vital role that government plays, that international organizations play, that NGOs play. We have product, we have shipping, we have transportation. What we don't have is expertise on the ground to deal with an outbreak. So complex problems will not be resolved individually. They will only be resolved working in partnership. And so the private sector supply chain work now has a wonderful relationship with the WHO. And the real beauty of it is the relationships we're forming are outlasting changes in personnel. This can't be the kind of thing where you get to know someone, you have a nice meal together, and then they both leave the organization, and that's the end of the work. So there's a new DG, Dr. Tedros, who again remains committed to working with the private sector to advance this work. So just a few more points. There's the timing of this event is auspicious. Just this week, and I'm going to sing the praises of Mike Ryan and the WHO, they released a document known as the disease commodity packages, and it's something that we in the private sector are just so excited to receive. So Mike and his team have done the really hard work of identifying across a range of pathogens what are the specific products that would be needed in an outbreak, and giving us a sense of the kinds of quantities that would be involved. And now they made that public. I think it was Wednesday or Thursday, Mike. And so now that we have it, we in the private sector can take those disease commodity packages, or DCPs as we call them, and begin mapping against it. We can say, okay, this supplier has volumes of this particular product, and that supplier has volumes of this product. We can also work with UPS, because again, UPS is a huge freight company. We can say, okay, here are the kinds of volumes that would be shipped in this kind of event, and you, UPS, need to begin thinking about how you would make space available in your system to make sure that this product gets from wherever it's manufactured to other parts of the world. So we're really, really excited about the arrival of these disease commodity packages. That said, this is far more complicated than I think people appreciate. So one of the other W organizations we are involving in our work is the World Customs Organization, because one might think it might make sense in terms of, or rather in times of an outbreak, that product would be shipped and it would be expedited into the field. One might think that, but that's not quite the case, right? Because every country has its own customs regimen. Oftentimes, they are not consistent from country to country. Too often, basic materials will sit in a warehouse or sit on a dock, and their movement into the field is delayed because of some customs issues. So we're having what we think are fruitful conversations with the World Customs Organization to say, can we create kind of a roster of basic product that would have pre-approval, so that in the event of an outbreak, all of the wonderful heroic physicians who are going into the field don't have to wait for the supplies to get there because it's hung up in some loading dock in some port because of some bureaucratic issue. So there are lots of things that have to be done to make this pandemic supply chain network operational. The good news is we have commitment from all of the relevant parties, and it's a sincere interest in doing that. Just a closing comment. There's oftentimes this view that, well, why is the private sector involved? Well, I can tell you, speaking for my company, but even the companies that are part of the network, we're involved for two reasons. One, it's absolutely morally the right thing to do, right? We all share this earth with everyone, right? And so we have the same values and the same interest as you do. But from a business perspective, it's also enlightened self-interest, right? Business cannot succeed in failed societies, and we have every interest in making sure that every society is prosperous. It's good for the people, it's good for their economy, it's good for the world. And so the motto of the World Economic Forum is committed to improving the state of the world, and that is the animating driving force not only of the forum but of the pandemic supply chain network and those of us who are involved. So with that, I'll close and look forward to your questions, and thank you for your time and attention. Take care.
Well, Mike, you thought I wasn't going to toot my own horn, and you were right, but I think I accidentally had you and Gerard and Maggie do it for us, and then, of course, then to hear from the innovative stuff that Tobias described is really thanks to the panel. And we want to hear from the room. I do want to start with just one question. We just heard that maybe the response is a finance challenge, it's a communications challenge, and it's a supply chain challenge. So the question, Mike, for you, is a response also a public-private cooperation challenge? What is so hard about public-private cooperation? What makes it so hard? And what is your kind of, from WHO perspective and based on your experience, what is your approach to getting it right? And maybe to shine a light on why it's so hard to get right.
Yeah, we'll be here all night then. Yeah, well, beyond finance, communications, supply chain, people often ask me, what's the most important thing in public health and surveillance and fighting pandemics? And I often give them an answer: three things: governance, governance, and governance. I think we do forget that at the center of all this are governments and the people who are mandated to protect populations. The ultimate accountability in any society for the care and welfare of a population is an elected government. But within that framework, the private sector and the public sector interact. I don't see the difference. I mean, I go back to the mid-90s when huge amounts of we heard it yesterday, of fighting meningitis and yellow fever in Africa involved private sector providing proprietary information on their vaccine production across multiple companies to us, so we could effectively buy all the vaccine on the market at a preferred price and distribute it to all countries on the basis of epidemiologic need. At that time, any one of those companies could have probably sold that vaccine on the open market for 10 to 20 times what they were ultimately paid for. So I've seen through my career wonderful examples of people in the private sector doing incredible amounts of good work. And equally, I've seen plenty of examples in my time of people in the public sector running away from their responsibilities and doing bad things. So this isn't us or them. For me, someone used to say, we're all one family, we're all one society. I liked what you said. Business cannot succeed in a failed society. So I think there's a mutual interest here. We all have kids. We all want to go home and see them in the evening. We all wanted them to think of us as heroes, as people who do the right thing. But we do different things to do the right thing. You're right. I think WHO historically has been very nervous about private sector engagement, and understandably in many levels, because there are huge pitfalls, especially when it comes to pharmaceutical products. There are huge potential conflicts of interest. There are huge swamps that can swallow you very quickly in that. But knowing that there are areas where we have to be careful in the engagement doesn't mean we can't operate in the 95% of the territory that is safe to operate in. And I think that's incumbent upon us all to do that. I think, and I thank you for the comments everyone made, I think WHO and governments in general, it's not just WHO, are really beginning to realise that pandemic preparedness is a shared societal objective, and the private sector is an intimate, important and essential part of that preparedness. Some of the data presented by yourself, Margaret, on who trusts who, and that would have been a shocking statistic 10 years ago. No one is shocked by it anymore. And I've seen that. Pastoral leaders, community leaders, business leaders in many countries are often trusted more. So I think we have, as I said in my talk, there's a massive challenge. There's a real major project that needs to be achieved. I think reinsurance companies were the ones who led the way. I know Jim Kim had a survey done with you a couple of years ago that looked at what were the greatest risks to society over the next 20 years, and I think epidemics and pandemics came right to the top of that list. So if we accept the collective risk, then we accept the collective challenge of managing it. Turning that in, though, and this is the thing, transforming that common purpose into real solutions, real funded, sustainable solutions that aren't just flags to be waved by others, that don't just turn into pork barrel funding of stuff that looks nice but doesn't deliver. That ability to be disciplined and truly cooperate, not just deliver what we think you need. And I've had situations in the field, clearly, and I have to say it, with private sector people arriving with boatloads of donations that were utterly useless to what was needed. And what was being looked for was a yellow ribbon moment. Cut the yellow ribbon, get the photo, get out of Dodge. I think it's much more sophisticated, much more mature now. So this idea of a sustained, coordinated investment, where we all leave our guns at the door, and try and do something practical with some serious practical outcomes. And I'd love to see. That's why, and you asked why we've very much engaged with your process led by yourself, Ryan, is that we see practical things coming out of the Readiness Accelerator. They're not earth-shatteringly important in the great scheme of things potentially, but they're real stuff that can be delivered in a time frame that's doable, and with not tremendous amounts of funding either needed to make them happen. So, and I hope we'll have a few announcements for next year, Davos as well, so some innovative stuff we're going to do together.
Thank you, Mike. I do have questions for the panel, but we do want to hear from the group, and so let's go to the floor. Hannes.
Thank you, Ryan. Thank you all for being here as well. It's good to sort of see private sector representation at a meeting like this. We talk often about the lives impact of outbreaks, but there's also the livelihoods impact as well, which is substantial. And what people often forget, actually, and miss, is that much of the economic damage that's done by these outbreaks disproportionately affects the already most vulnerable groups around the world, so they're already marginalized. So it's great to see that we're now being more collaborative about this. Tobias, it's great to hear you speak. Financing and solving some of these financing challenges, clearly a really big part of it, and the PEF is a useful adjunct in that landscape. You talked about sort of other types of funding that might be available as well, and one of the things that I've been thinking about recently is whether there might be other insurance-type interventions that might work below the country level. You know, the great thing about the PEF is that it's a World Bank-backed initiative that provides funding for countries who aren't necessarily choosing to pay the premium. It's the collective community choosing to pay the premium. But we know that historically, when it comes to things like insurance, governments, companies, individuals tend to underinsure. And that drives one of these cycles of panic and neglect in terms of financing and flows. Could you share any thoughts that you have had about sort of how we might address that, and whether there's scope for financial innovation sort of targeted at things other than countries?
Am I on?
Yeah.
Okay. Thank you. Very good question. It also allows me to react to your first question about some of the challenges. So I guess wearing my salesman hat, I would say, look, if somebody wants to buy insurance, say, instead of at their supranational level, like the World Bank did, but at the national level, then they could. The Pandemic Emergency Financing Facility shows that you can tailor such a product, and you certainly could. For example, initially there was thinking, does a country, or does a donor, let's say, want to buy top-up insurance for a specific country that they, because it fits into their collaboration, or because that country's primarily exposed and so forth. And so the major challenge to that I see, and a country could buy that for a certain district, or for a region within its territory, or something like that. The major challenge that I see is that the proposition of buying market-based financing is really alien to the public sector. And I get it, I understand it. So this idea that, and again, I want to just make sure, so we provided the service to the World Bank, who are the buyer of this insurance, and they were able to afford it with assistance from a few donors, including from the IDA fund, by the way, the fund for the poorest country within the World Bank. And as I observed that debate, should it be renewed? Should we start preparing for when this policy runs out? And in 2020, do we need to start working on the next coverage and so forth? I observed that the challenges that are being worked through are not on the technical side, not on designing better coverages, better indexes to capture the risk and so forth. Certainly, there's a ton of work to be made in that. But it's more about, does this provide value for money for public sector? Because the idea that you will have paid premium to, let's face it, big finance, right? So the risk takers here, these investment funds that invest in this is Wall Street. The idea that public donor funds end up in their pockets and there is no triggering event over the period of that just scares public officials like crazy. And you can look at that in a number of ways. I mean, think about your health insurance, right? In a sense, the best outcome is that you pay premium every year and you never use it, because that means you never got sick. But people have different views of that. Certainly in the public sector, I think the idea that there is no triggering event, what they really hope for is a triggering event that doesn't really hurt anyone, but that they get as much back as they paid premium, which is a little bit absurd. But I don't mean to belittle this conversation at all, but I think it illustrates to how innovative this really is, largely from their perspective. This idea that you would pay capital even if the benefits, at least the potential benefits of an early trigger of having this leverage where you pay a certain amount of premium, but if it ever triggers, you get a much larger benefit out of it. Even if that is recognized, I think the main obstacle is kind of this idea that public funds end up in private pockets.
Can I just ask a follow-up?
Sure.
I'm sorry.
Sure.
What if there are too many triggering events?
Yeah.
What does that do to private sector appetite to provide that?
So we're back to the intricacies of the product a little bit. So there's a model that was designed by a third-party vendor modeling agency that does this type of stuff for the insurance industry, and it works with flights and passenger movements and seasonalities and a gazillion different factors, and then it comes up with a curve that essentially puts in a relationship the probability and the severity of the outbreak. Sort of a loss frequency curve, we call that. And then whoever wants to buy such a product basically decides, well, what is the attachment level at which you want to buy your insurance? And so if you buy something that the model predicts will trigger once in, every 5 years, then whoever takes this risk is going to say, well, I'm going to need a lot of premium to cover that. If you get something that has a probability of triggering once in every 100 years, then every Minister of Health is going to say, well, I got tons of stuff to do until this thing triggers, so this is not a priority anymore. And so that's where you have this trade-off between how urgent or how often do you want it to trigger, how much premium are you willing to pay for something like this, and how high up on the list of priorities is this really among all the different things that you need to consider. And so I would say it's a price question. If you want it to trigger every year, then we're swapping money, right? I'm gonna ask you so much premium as I expect to pay out to you. So that's not an interest anyone. This, I can share that the PEF has different tranches and so forth, but it's basically designed to trigger has a 5 to 10% probability of triggering every year. So that was essentially, that's the buyer who decides that, right? It's a bit like you're choosing your deductible or your copay.
I have a closely correlated question, sort of the other side of that question, which is you have a room full of people who are interested in mitigating those triggering events. So when you think about these public-private partnerships or collaborations, how can these organizations collaborate to reduce the premium so that the organizations purchasing the insurance actually pay less? Because that's something we'd all want to do.
I might take the next two. And then
Sure,
the next one.
sure.
I was just noticing the time. I thought maybe take the next two questions as well, and then we'll take them all together, if that's okay. Tobias, sorry.
Yeah.
Yes, thank you for the panel. My question is the internal process of the get legitimacy inside of the WHO. In the case of multi-drug resistant tuberculosis, WHO endorsed the very novel drug sensitivity test. This is produced by private-public partnerships in Europe, in Belgium, and in I think this is Netherlands, and it is quite great. I think it's great, but I wonder what was the internal process to get legitimacy inside of the WHO, and I wonder it is because I'm very fascinated by it.
Hi. So
Question?
I'm very interested in this insurance thing because, it hinges on thresholds where you have to believe your probability. 5% probability. In my world, that doesn't mean anything because infectious disease outbreaks, defining what that means, you can throw in airline data, you can throw in all this stuff. The models are not very good, and the uncertainty is huge, and these are rare events that start small and can look mild and whatever else. And so I wonder, you said in your talk, if you believe the model, then you're willing to buy the insurance. But, I don't believe the model at all, right? And I think a lot of infectious disease epidemiologists would look at these giant simulation models and say, this is nonsense. We don't know how people are moving around Sierra Leone. We don't know, any of the underlying parameters of the model. So your confidence intervals are enormous around that probability. And for any trigger that's a go, no-go decision, I wonder how governments and how we as a community interested in doing this better can think about communication of those uncertainties in an honest way so that what happens is people lose trust in the whole concept.
Could I maybe address part of that, because your point is well made. If you look at the cash window of the PEF, it's not triggered by the model. It's actually triggered within a group within WHO, a scientific technical advisory committee with people like David Heyman and as a
and
chair.
Those triggers are more.
And the data is presented to a learning group, and it's a hive mind. And the decision is made regarding the public health importance of the event and the need for a response. So I think over time, I think as the instruments develop, there's going to be different layers within it. But you're absolutely correct. But you have to start somewhere. And the issue here has been, how do we get the private sector to participate in indemnifying the risk associated with disasters as such? And within that, there may also be ways to have incentives in that for preparedness. Because if countries, for example, already within the PEF, there is this concept being developed that countries who engage, for example, in implementing 5-year national action plans for strengthening their own capacity across the 13 different core capacities, that if countries invest in those capacities, that there are donor countries willing to pay premiums and willing to reward those countries within the PEF for having done so. So there is a way. I don't think we're there yet. I don't think we've reached the best instrument, and for example, while it may be a very large fund, in a true pandemic, it'll be gone in 5 days. I mean, that's just the reality. So this is the first attempt to create an instrument that in some way tries to manage risk with a payout, tries to incentivize preparedness and having governments think through the issues, as you were saying, Tobias. And we, I think, can begin with you and others to see, can we come up with better models? Can we come up with better predictive analytics to look at impact and everything else? But like everything else in Ireland, when you ask for directions, usually people say, well, you know what, if I was going there, I wouldn't start from here, you know? And we have to be very careful, because it's very easy to say, well, if I was doing that, I wouldn't start from there. It has started, it exists. We have seen the cash window triggered for the last Ebola outbreak very successfully. There are issues through the whole system, but I'm not here to defend it. We're advisors to it, but I think it's important to recognize that it's a good first step, but your points are well made. We have an awful lot more work to do to adapt these instruments, both for the private sector investors and for the public sector users of those funds when they get triggered.
I think so a couple of comments. You raised excellent points. Don't trust the model, would be my advice. But one of the benefits that it does have is that you obviously have historical records of outbreaks. And so once you have that model, you kind of back test it, you apply it, and then you can sort of determine when would it have triggered in the past. And so for the PEF, as far as I know, for some of the pathogens, they went back, hundreds of years. Obviously, the WHO wasn't reporting, didn't produce Citreps and Dons and stuff at the time, but nonetheless, so that's a bit of an assumption when those would have been reported. Other than that, you're right. There is, it's called basis risk. In other words, there is an event, but it's not captured by the parameters that you have selected. And so that is why there are different sources of funding that were put in place. That the cash window that Michael refers to has activation criteria, they're called. Now those, I'm sure they're written down somewhere, but I'm also pretty sure you can negotiate them. So that provides a lot more flexibility over that larger layer of insurance where you can't really negotiate. Having said that, there was always a big discussion when this was placed. Say you've agreed on 250 reported deaths of a certain pathogen. What if it's 249? So this thing doesn't trigger, and the world has a big problem. It wouldn't because this is it's like a security, and there is 300 pages of documentation. So. But that would be an uncomfortable situation, I think, for all sides. Regarding the question about mitigation and prevention, obviously, the World Bank will be the first to tell you that whether it's natural disasters or disease outbreaks, prevention and mitigation is what comes upstream before you think about financing. You don't finance from the first dollar, right? You don't finance just as you have a deductible for your car. If you have to absorb a certain risk, and you have to mitigate that risk by being a good driver, and by this is why we insist on having people having to have a driver's license and doing car training and driver training and so forth. Would such measures actually trickle down into smaller premiums at a country level, at a global level? I mean, you'd have to have a pretty detailed model to capture that. I mean, let's assume. So there are some Ebola vaccines out now. Let's assume the whole world is vaccinated. Yeah, then sure, the probability of a huge outbreak, it stands to reason that will be lower. So therefore, the premium would go down. But if certain districts, let's say in a country that is still overall very ill prepared, are making certain improvements, again, do you have the model to really capture the improvement, the resilience of that country at that granularity, and that it then translates into lower premiums? I think we're not quite there yet.
Getting there.
One of the things, Tobias, that you had mentioned was the challenge in the onset was on almost a philosophical challenge with public sector paying private sector premiums, to a private sector company. I wonder if we find the same types of challenges in other areas, and I'll turn to you, Gerard, and then to Maggie. If in many ways, and because I put you on the spot, I'll lead you a little bit, Gerard. When it comes to supply chain, some of the answers aren't that hard. But rather, there's a conversation that we've had to have, and you've been having, over some time on some of those philosophical issues. I wonder if you could shine some light on them and what that process has been like and why it's so important.
Sure, happy to do so. Mike Ryan used an important term not so long ago, governance, and that has been a large part of what we've been discussing over the past few years. As I indicated in my earlier remarks, the private sector and the WHO hadn't always had the fruitful relationship that we have now, and part of the reason we are where we are now is we've just gotten to understand what's important to each party. And speaking for myself, but also for the pandemic supply chain network, we have a much more acute understanding now of the political challenges that the WHO manages on a daily basis and why governance is so important. Mike also made an interesting point, and there's no denying it, that there have been instances where the private sector donates product because it's beneficial to the private sector, but may not be beneficial to the recipient, right? And so the beauty of governance, particularly these disease commodity packages, is we know exactly what the community will need in a time of crisis because it's there in black and white on paper. We know the products, we know the amounts, and now we can map against that. So that's an example of how governance will allow us to keep each other honest, right? And in doing so, allow us to advance a relationship perhaps in a way that wouldn't have been possible in years past, and so that's why we're optimistic. That said, all of these things are easier said than done. I mentioned customs regulations. One would think that a glove and a gown and a mask is such a basic item that there wouldn't be any kind of challenge from country to country in terms of customs and moving it into the country. But you'd be surprised, right? And so one of the things that makes this more complex than it needs to be is varying degrees of regulation and inconsistent standards across countries and organizations. And so to the extent that we can begin to break that down, again, for basic items, we will have done the world a service.
Go ahead.
So I think in terms of communications, it's actually making it easier. I don't think it's necessarily complex. I think most of the companies that we work with, the very large-scale multinational corporations, they know what to do in terms of a recall, product recall, or if they have a supply chain issue, they have very sophisticated crisis plans in place and business continuity plans in place. But when it comes to something, again, recognizing that fear can be as disruptive to the business as a supply chain disruption is something new and different, and it's a different level of communications. When you have to talk to your employees and you have to reassure them that if there's an epidemic, that you're well prepared to manage it, you'll safeguard their health, you'll watch out for their families. It's a very, very different kind of approach, which is why I'm very pleased to be part of the working group, because if we can put that into a toolkit and really help company communicators have a go-to resource that really will help them manage the very scary aspects of an epidemic, but doing it in a way that's meaningful company to or country to country to country, I think we can make it easier. And I think then people will be more receptive for playing a larger role. Because they can do it from a business continuity, they just aren't doing it yet from communications through the employees into the communities.
Thank you, Maggie. We'll take it back to the floor. Yeah.
So hi, I'm part of the firm that developed the models for the PAF, so I felt I'm responsible to defend the models that we built. I just wanted to mention two things. First is that, as it has been mentioned before, the model, the responsibility of the model is helping the decision makers to make a better and more informed decision. By no means the model is going to say the accurate number of the cases or deaths that we may see in the next epidemic or pandemic or whatever. But if you think about the goal that we all are pursuing, which is reducing the the economic loss, reducing the number of deaths in the pandemics that we are going to observe, so the models try to help us to put us in a narrower path, which helps us to reduce the risk, and it gets help from the historical events. Also, the feasibility of the emerging outbreaks and pandemics by knowing the characteristics of the pandemics. We know that we may have disease X, that we don't know anything about it, but with whatever information we have, with the new technologies that we have, with the computational capability that we have access to, the models are capable in helping us. I mean, I used to be with the public sector. Now I happen to work with the private sector. And what I observe is that I don't know why people are very conservative. I really appreciate the expert opinion, but why don't we use these new technologies when we want to make decisions, which comes from the mathematics, geographical sciences, the epidemiological sciences, computations. I think if you think about the goal that we all are following, using everything, all the tools that we have in hand is going to be beneficial. It can be model, it can be surveillance, it can be better surveys, whatever we have. So I just wanted to say that try to be open to the new technologies that we have access to. So thank you.
Ryan,
Sure, Mike.
just on this, because if you pull together the wonderful panel that happened before this panel around data and all of that, and we think about the data and innovation package that's within the Epidemic Readiness Accelerator, recent engagements we've had with the Ending Pandemics Collective and some major foundations like Wellcome and Gates, there is a huge appetite both in the private and public sector to advance this whole area of forecasting, predictive analytics, modeling and all of that. But as Charlotte said, it's an area in which there's going to have to be a huge investment, because it's not just about the artificial intelligence engines, it's about the data that's mined, it's about ownership of that data, it's about a whole range of issues that are both regulatory, they're about privacy, and remember, we're all sitting here in North America. There are other stakeholders around the world, in China, in Malaysia, in India. The real engines, to be quite frank with you all, and the people we're having the biggest discussions with are in China and in India right now when it comes to data analytics, predictive analytics, artificial and augmented intelligence. Quite frankly, they're ahead of the game. So this is a very skewed conversation in a very limited environment right now. But there needs to be a huge step forward in that area. But I think this is where the WEF and the private sector have the capacity to bring the investment, to bring the knowledge, and to work with the academic institutions in particular who've been shining the way and shining the light on the path here, and then the usefulness of that for organizations like WHO and government. So can we put all this together? And I think that this conversation has been about today is how do we leverage the knowledge, the skills, the passion, the capacities and the investment capacities of all of the institutions across the public and private sector for some grand projects. Some of that's going to be around developing new drugs and vaccines. Some of that's going to be around developing new financial instruments to fund preparedness and response. Some of that's going to be around new data and IT innovations for data capture, data transfer, data analytics. And that's what I would like to see coming out of meetings like this, is we take that big next step, like you're saying, to stop being afraid of embracing these big ideas, and in the area of pandemic preparedness, take 3 or 4 big ideas and actually make something practical come out the other end. Like we've been talking to Jared here. If you're in the field today in Congo, It's not the epidemiology that's difficult. It's the security. It's keeping 280 people alive in the deep field and supplying them with food and with vehicles and with security officers and with flights and with minus 80-degree vaccine and with coolers and with protective gear and all of this other stuff. It's 90% a logistics operation, 10% a science operation. It's a big hammer driving a very sharp nail. But without that big hammer, nothing works. And if we have a pandemic tomorrow, I guarantee you, it won't be a failure of science that will stop us responding to the pandemic. It will be a collapse of our ability to supply the people in the front line and our own communities. So for me, I think the issue for us is look at supply chain, look at data innovation, look at financial instruments, look at communications, look at data analytics, and see can we collectively come up with some big ideas. And for once, private and public sector get behind those ideas for long enough to make a difference. And I would just, I don't know, I'm being passionate about it now, but that has to happen. Because the prospect, we're not talking about the next epidemic with 100 cases. We're talking about the next pandemic, potentially where millions of people will die, and our economy and our societies may actually just stop. And what is it worth? And what are we prepared to invest as a public and private sector to stop that or mitigate the impact of that? And I don't even think we're at the races yet when we're talking about the scale of investment we need to make that happen.
And I would just add to that, one of the particular items of great interest to us in the private sector on the supply chain side, and this may be wishful thinking, but we would love to have some kind of early warning system, because it takes time to get raw material, turn it into finished product, and get it shipped to a location. And so if the world turns to us when the outbreak is already raging, it's way too late by then. And so the sooner we know that there is something brewing, recognizing that the data is nowhere near being perfect, in a way, of course, that from a communication standpoint doesn't result in panic either, we can begin doing all of the work that we do to accelerate the supply chain. To Mike's point, that is such a critical item that tends to be overlooked until until it breaks.
I'm mindful of the time, but let's do one more question.
Just one quick
Yeah, no, we need to.
Well, actually, it should have ended on that impassioned speech. And, that's awesome. I just want to sort of hop in to say, I know that this is a 1.0 version of this insurance mechanism that's coming, but is there any conversation about how it might be used as an incentive for, let's say we know, logging companies that log and then expose surrounding communities to new vectors, or maybe even the arms suppliers for belligerent groups in the DRC. All of those companies and private sector actors are actually increasing the risk of emerging epidemics. Is there any sort of thought of using insurance eventually as a tool to require or compel them to pay into a fund when their actions in the field are increasing the chances of an epidemic or outbreak?
Well, I certainly can understand the background or the reason for you asking that question. I think that's a regulatory, or that's somehow a policy decision that somebody would have to take if you engage in this economic activity or in this illicit activity, and this is the penalty you will face, or this is the cost that you have to contribute to the externalities that you're causing. It's not really a contingent financing proposition, so it doesn't lend itself well to insurance. Because it's like rust. It'll happen. If you don't want it, you need to clean your bike. And so it's not something where you have an, insurers call it, it's sort of, there's no element of randomness in that, if you will. If you know that if you're, the causality is there basically, it might not be so linear or not so direct, but no one's gonna sort of take the risk on that and say, I'll insure that. I'll insure, this mining company destroying the rainforest somewhere. Well, no, because they're doing it. We know it's going to happen. So there's no. It doesn't lend itself to a transaction, if you will, like that. Other problems are a bit different. For example, the World Bank is now working on a famine response mechanism or at least trying to see if that could also be possible for international response to famine situations.
With that, I think we'll thank our panelists, and thanks for the questions, and we'll move on to the next session. Thank you, Shana.